welcome to the Harvey podcast. In this podcast, we explore topics of psychology, philosophy, mental health and therapy, as well as the intersections between these disciplines. If you'd like to support the show, please visit the Patreon page. The link for this can be found in the show notes of the podcast. Also stick around to the end of the podcast to hear about more details of workshops, different ways you can support, and upcoming shows as well. Have a good listen. Hello and welcome to the Harvey podcast. Today we're going to be talking about trauma-informed care. So today is an introduction to trauma-informed care. It's a very comprehensive, very all-encompassing topic, and today we probably only have scope to introduce what this is and look at a little bit of how it might be implemented on an individual and a cultural level. Okay, so we'll start off a little bit by talking a little about what is trauma, and we'll go on to look at what is trauma-informed care, what's the historical context of that, what's the principles and the philosophy behind it, and then we'll go on to look at how might this be implemented on a service level and on an individual clinician level. Okay, so to start off with, what is trauma? In the first episode of the podcast on vicarious trauma, we looked at defining this term, coming up with a working definition while acknowledging the reality that trauma is such a huge concept and different people will define it in different ways. There still remains controversy within the literature exactly how to define this term, but as a reminder from the first episode of the podcast, we talked about trauma being a result of an event or series of events that an individual experiences as physically or emotionally harmful or life-threatening, and that this has lasting adverse effects on the individual's functioning in terms of mental, physical, social, emotional, and or spiritual well-being. Within the first episode, we also spoke about the importance of considering not just the events themselves, but also the wider impact on how the individual might incorporate these traumatic experiences into a sense of identity, and how they might organise their experiences around the traumatic event and the impact of that forming a core aspect of a person's identity. So I think this really highlights the idea that, yes, while trauma may be from events, we need to consider the holistic impact that this will have on an individual. Okay, so that's our working definition of trauma, and with that in mind, what is trauma-informed care? So before we get into exactly what trauma-informed care is, I think it's useful to define what it's not, and what I think it is often conflated to be. So there's this difference between trauma-specific versus trauma-informed care. Now, trauma-specific care is working directly with traumatized clients, and this involves engaging in specific trauma therapies and interventions. This work is often carried out by trauma specialists, often psychiatrists, psychologists, psychotherapists, who have had specific training in how to work with the impact of trauma. So this is often therapeutic work directly targeted at the impact of a traumatic event. And trauma-informed is not this. Trauma-informed is not designed to treat the symptoms of trauma. Rather, the aim is to provide services in a manner that is welcoming and appropriate to the special needs of trauma survivors. And it's just to clarify that we're not going to be talking about trauma-specific care or trauma-specific models. We're going to be talking about trauma-informed care, which is the latter of those two described. So the historical context, where did the trauma-informed care approach come from? So it largely comes from the early 2000s, first suggested by Harris and Falat. It was suggested due to an identification that there was a high percentage of clients within general health and substance misuse services having substantial trauma histories. This was recognised within clinical practice and within the research, And not only did they notice that there was a high percentage of clients with a trauma history within these contexts, but that actually they frequently experienced the services that they received as re-traumatizing, and often through not just individual practice, but at operational procedural level. So they first sort of coined this concept in the early 2000s of trauma-informed perspective, trauma-informed approach, trauma-informed care. The idea has probably been there for much longer, but the actual language and terminology started in the early 2000s. This was taken further by the Substance Abuse and Mental Health Service Administration in the United States throughout the 2000s and the early 2010s. Their work is still ongoing. They've often provided lots of documents and research into the trauma-informed approach into multiple different settings and how to implement this, and the evidence base for that has been hugely informed by that organisation. So one of the core aspects of the trauma-informed approach is what's called the 4 Rs. So these 4 Rs are realise, recognise, respond, and resist re-traumatization. So realise is capturing that there's a need in services and for individuals to realise that trauma is present within individuals. So at every level of an organisation, that trauma is present, that it can affect families and groups, as well as organisations and communities. So realise, I think, is that idea of just acknowledging that trauma exists. The second R is recognise. So this is the idea that the organisation or the individual recognises the signs and symptoms of trauma in clients, families, staff, and others involved in the system. So it's this sense not only realising that trauma is a thing, but also recognising the specific symptoms of trauma within clients and systems themselves. Fourth R is respond, and this is the idea of fully integrating knowledge about trauma into policies, procedures, and practices at all levels of the organisation. So it's one thing to have a knowledge of trauma, to realise, and to be able to recognise the symptoms and the clear signs of it. With the third R, we're talking about actually responding to it, actually incorporating this knowledge into policies, procedures, and practices with the aim of creating services that are safe for people who have had traumatic experiences. The fourth R is resist re-traumatization, and this captures an idea of actively and continually targeting services and staff. So it highlights this idea that this is a continual and ongoing process that is aimed at not causing further trauma to people who have lived through traumatic experiences. So those 4 R's form the core philosophy behind the trauma-informed approach. That's realise, recognise, respond, and resist re-traumatization. Okay, so the 4 R's often go into form what's referred to in the trauma-informed approach as the 6 principles. So these 6 principles are safety, trust, choice, collaboration, empowerment, and cultural consideration. In the original research, there was the 5 principles, the first 5, and later work has added the addition of cultural considerations. So what do these 6 principles mean? So from safety, safety is aimed at capturing physical, psychological, and emotional safety for service users and staff. This is also incorporated in the idea of the physical setting being safe and interpersonal interactions that promote a sense of safety. So trust, what does trust mean? Trust is captured by transparency in organizational policies and procedures, and this is extended to service users, staff, and the wider community. The goal of the organization is on building and maintaining trust with clients and family members, and and also among staff and the community at large. So this idea of transparency between organisational policies and procedures, and actively building trust and maintaining trust. Third one is choice. So this is captured by the idea of supporting people to engage in shared decision making and goal setting. This idea that staff are facilitators of recovery rather than controllers of recovery. And I think it's really important at the choice level to recognise that within organisations there is a historical and current power differentials. It's important that services and organisations recognise the awareness that choice may contribute to mitigating the impact of historic and current power differentials. Next principle is collaboration. So staff, service users and the wider community working together to overcome challenges faced. This is both in relation to immediate care as well as within the wider system as a whole. An understanding of and demonstration that healing happens in relationships and in the meaningful sharing of power and decision making. So this idea that active healing happens within collaboration and it happens in relationship in a meaningful way. A recognition that everyone has a role to play in trauma-informed approach. So I think this is really key, that for a trauma-informed service or a trauma-informed approach to be effective, it needs to be undertaken by everybody. It needs of every aspect of the organisation. We could even sort of talk about a trauma-informed society, and that would encompass every member of society holding and collaborating together with these principles in mind. Next principle is empowerment. This is the idea that power is shared between service users and staff, among people using the service. The idea that strengths are recognised and built upon, so rather than focusing wholly or just on people's deficits, people's strengths are recognised, and the aim is to build upon those in helping people to move forward in their lives. Empowerment for staff and service users alike, and this is often through not just individual work but actually through organisational support. Likewise, communities are empowered to engage in healing. So again, we have an idea of this being at every level. Empowerment needs to happen at every level within an organisation and within the culture. Lastly, we have cultural consideration. This is an additional principle added after the first five, and this principle captures the intention of a move past cultural stereotypes and biases. This is important to incorporate in the policy, procedures and processes that are responsive to the racial, ethnic and cultural needs of individuals served. It also, on the cultural consideration level, recognises and addresses historical trauma caused based off of different cultures acting towards others. And with that cultural consideration, I mentioned it in previous podcasts, but I really think it's a very useful resource to look at, is the social graces model by Burnham. It really highlights how all the different protective characteristics may come together and form intersectionality and ways of thinking about that psychologically. So if you haven't checked out already, highly recommend Social Graces by Burnham. Okay, so we've looked a little bit about what trauma may be and working definition of that. We've looked at what the trauma-informed care approach is, and we've looked at that from the element of the 4 R's, the 6 principles. So with that in mind, we're looking now at how might trauma-informed care approach be implemented. So firstly, a way in which this might be implemented is through a commitment to change. So this is a commitment on an organizational and an individual level. So everybody within the organization, right from the individual themselves through to the CEO of an organization, the upper management of the organization being committed to changing and implementing the principles and philosophy of a trauma-informed approach. I think this is something that's really, really key to the trauma-informed care approach, is that it is something that is targeted at all levels. I know I've said it a few times throughout this podcast, but it is really key to understanding this usefulness, its implementations, and the core aim at what its approach is aimed to do. So this also involves an understanding of trauma. That's captured by the first R, being able to realise the impact of trauma. However, this, as we said earlier, trauma is such a broad topic and quite hard to define, and I think therefore it's important that at all levels of an organisation, maybe particularly with upper management, there's a engagement in the literature and in up-to-date literature, as well as those who are able to be able to continue to engage in literature around trauma and also around trauma-informed care. There's a concept of trauma champions within services. That's another idea in terms of implementation. So a trauma champion is somebody who will be within a team or a multidisciplinary team and always hold a trauma-informed perspective. So within group discussions, within organisations, the trauma champion will hold the responsibility for always taking a trauma-informed lens when it comes to any decision making within that organisation. It kind of helps to embed the principles of trauma-informed care within organisations in a way that is ultimately quite collaborative and might fit already within the culture of a service that's already established. This will probably involve additional training for the trauma champions, to allow them to most effectively practice this skill. I think a key sort of aspect that's captured within some of the principles, particularly around trust, is this idea of transparency in policies and procedures. I think this is important on so many levels in terms of how accessible are these policies and procedures, and actually how understandable are they? Are they written, or is there a part of them that is written in easily to understand language or communicatable language for people to actually not only be able to find the policies and procedures, but also to be able to understand them? And this is not just across the staffing body or the members of that organisation, but also anybody who's sort of using that service and the wider community as a whole. Transparency is key. Another aspect of how we might implement this approach is through co-production. And co-production is the idea of bringing in service users, people who use the service. You can see this in a mental health context, bringing in people who experience mental health challenges, who have used various services that might be on offer to help to co-produce the running of those services. And the thing with co-production is this can often be used in a tokenistic sort of a way, where experts by experience will be brought in to evaluate or help to update one aspect of a relatively low level delivery of the service. I think true co-production would aim at experts by experience, but having involvement at every level of the organisation, right up to the top level, in informing and co-creating how the services move forward, and if it's a new service, helping to actually produce the service right from the grassroots up. I think there's also this idea of reasonable adjustments within services. So reasonable adjustments is this concept of how can, within the service how the service normally operates, how can adjustments be made to protect and make people feel as comfortable or engage in the service who might have histories of trauma in this context. Reasonable adjustments is often used in other contexts for people who have learning disabilities as well as other mental health diagnoses, but I think we could start to think about reasonable adjustments from a trauma lens in terms of being able to create reasonable adjustments for people who are trauma survivors. Is there situations and contexts that we might be able to make reasonable adjustments to, such as places that do not have loud and sudden noises in them. This may trigger somebody who has had a trauma experience and cause them to be in a trauma response from having overstimulation. Maybe we can create environments and have reasonable adjustments for seeing people in contexts where there's not loud noises. It's more of a quiet environment. That's just one example, but I think there is many potential reasonable adjustments that can aid in implementing a trauma-informed perspective within multiple services. Okay, so in conclusion, I think a big thing to take away is that trauma-informed care is separate from trauma-specific care. Trauma-specific care being directed specifically at people who have had a trauma experience and working therapeutically with that population. Trauma-informed care is much broader than that. It's about creating services that are safe for people who have been through trauma experiences. And this could be in a healthcare setting. It could also be in any kind of context. It could be within a bank. It could be within a governmental service. I think a trauma-informed care perspective can be at any level, really. Whereas obviously trauma-specific is much more specified. The focus of trauma-informed care is the provision of services, and with people with specific needs of having had trauma, and this is also with the idea of not causing further re-traumatizations. The two core aspects of the trauma-informed care approach is the 4 R's, which are realise, recognise, respond, and resist re-traumatization. This forms the underlying philosophy of the approach. This is then applied to create 6 broad principles of safety, trust, choice, collaboration, empowerment, and cultural consideration. Taken together, these form the backbone of what the trauma-informed care approach is. We also explored a little bit around potential ways of implementing this. We talked about co-production with experts by experience. We talked about reasonable adjustments. We talked about trauma champions within services, and we talked about the transparency of policies and procedures. Thank you for listening to the show today. If you're interested in supporting the show, please do visit the Patreon link in the show description. There's various different packages involved in the Patreon page, right from just supporting the show to further access to additional resources and access to workshops. You can also visit us on the website hereforyoucounselling.com. That's hereforyoucounselling.com. Again, a link within the show description. If you'd like to book onto additional workshops, there's also a link to the Eventbrite page in the show description. There's a variety of in-depth discussions around lots of the topics that we talk about in the show today. Thank you for listening. Hope you've enjoyed the show.